thing.
Or not even on a daily
Yeah, I mean
basis.
on a daily basis. But since we're getting ready for our survey,
Right.
they're super nitpicky about hand hygiene, bag technique. You know, when you walk into the home, they look at every little detail, and sometimes you get nervous.
Yeah.
It's a nerve-wracking experience because I've had a surveyor look at me over my shoulder, and you might do stuff. It's always good to remember that even if you mess up once, to not
Back up.
make that a big mess up continuously. Like I'll give you guys an example. We had a nurse who would use the same dirty chuck, and we told him after the first visit, like, you need to get rid of that thing. And he was so nervous, he put it in his bag again and used it again. So it's just, you just do your routine. That's why the most important thing is to make it a routine, that no matter when, the surveyors know that, okay, they pick up on that too. They can tell it, this is the first time you're doing this. And sometimes the patients might say, hey, you've never done this, what are you doing, It's like a red flag. So it's good to make it a routine, so it protects you and your family and protects the patient. So Frida will, and this doesn't mean this is the only way you do it, but there's universal infection control standards that you have to do. It's more about how to handle your bag, what to do, and she's been through hundreds of surveys with surveyors. So
Wow.
and again, it could be
Yeah.
you might have a different technique, but the concept is the same pretty
Correct.
much.
Yeah, it's not how you do things. Everybody, like, nursing is like driving a car, right? Like, everybody gets used to doing it their own way, and to each its own. It's not wrong, it's just that we just have to make sure, because most surveyors, they all look at the same thing overall, but somebody's like really picky about washing your hands. Somebody's really picky about what you do with your stuff. Some don't even watch you. Some will just, so you don't know what kind of surveyor you're faced with. So it's just good to practice these techniques just to be on the safe side, to not get any conditional participations for the agency, because then it's, a problem for everybody. But and they watch us like hawks. So I know Greg mentioned already, you don't have to wash your hands, it's not a thing, but like for me, sometimes I like to wash my hands after, if I've done a few visits. You can do that, but you have to know that, like, you don't set your bag down. If you're gonna wash your hands, if you have a wound care patient, you do have to wash your hands. But if you're gonna go in, do not put your bag down. Go in with your bag. I don't know what kind of bag anybody has. This is like my 20-year bag I've been using. It's from Amazon, Like, I will have if I know I'm gonna wash my hands, I have my soap on one side that I know I'm not gonna put my bag down. Because, like, let's say I'll have it here and I go to the bathroom. When you first thing first, like when you walk in, you have to introduce yourself and ask the patient for 2 forms of ID, because that's what we say we do at every visit, and it's a requirement. So when we go in, and then I will wash, and you have to have
So
your
liquid soap
napkin.
liquid soap is okay.
Liquid soap, it has to be antibacterial.
Okay.
So Dial is like your go-to, but that's it's a pain because it gets all over your bag, but. And then you have to use your own napkins. You cannot touch the faucets. You have to, like, I have my roll of paper towel, like, a lot of them. Okay, so if you have a Ziploc, like, I have things labeled. They like to see that, like, of course, on a day-to-day basis, when you're doing like 7, 8 visits, it's hard to keep and maintain. But like, I'll have like these, especially if I know I'm going in with a surveyor, I'll fold a couple, and then if I have to wash my hands, then I will do that. Now, I use paper towels for my barriers, so before I put my bag in, and then I'll kind of just unzip it, and I always have my alcohol here, so I'll, like, if I have to touch my bag, I'll make it routine, like, just pump it, hi, how are you guys, like, you can never do enough. Now, and then I just roll my paper towel out, yeah, I do, like, 2 layers just to be safe, to cover like all the surface that I'm gonna put my bag down on. And then just talk to them, like, don't stay quiet and be like, oh my god, because then they feed off of that too. They're kind of. And then I put it down. I'm gonna turn this table like this so you guys can see. But like I put it down like this, and then this will be in here, and I leave this out because I've already touched it and taken it out. So, and then the next thing I take out is my alcohol, and then again, like once I sanitize, that's my alcohol wipes that I use to wipe my stuff. I know you guys use the Sani cloth. It's the same thing.
So talking about the Sani cloth, it's super important. The ones you guys use is 2 minutes. So when you wipe your equipment, you have to set it to dry for 2
But
minutes.
can we just use that instead of a Sani?
Those are better.
Okay.
So yeah, it's,
So we'll keep that one.
yeah, keep it, but it's important they look at that. If it doesn't dry the full 2 minutes, then it's not effective.
Okay,
So
so it
once you clean it, you gotta let it
dry.
dry before you put it
2
back
minutes?
into your 2 minutes.
So it's not considered clean unless they let it dry, right?
Let it dry, yes. And that's one thing they really focus on to make sure.
It says on the packet 2 minutes.
For survey purposes, I usually use a Ziploc because it's just easier and they don't knick-knack at you. But like, of course, it's not cost effective for us to use the Ziplocs. I also have these that I use for like my everyday visits. But like, you always want to have something that you're gonna dump everything out, and you don't want to, like
So regular plastic bags is fine.
regular plastic
Yeah.
bag is just fine. I use, like I said, these just for survey purposes. Like, and then I have my little alcohol wipes, which again, you guys have the Sani cloths you can use, but like to wipe the buds of my stethoscope. Now, every time, like again, when you're talking to your patient, like you go in, you don't have to change gloves. You don't have to wear gloves to take vital signs unless the patient has open wounds. You guys know that already. But it's just, just rule of thumb, you can use it just to be safe, but always in between, like this is my thing, like Greg will tell you, I've had surveyor tell him like, oh, she like sanitizes too much. But there's no such thing as too much. So just
Too
keep,
little is a problem. So it's
too
better
little
to
is a
do
problem,
more.
but if you
Too
keep
much is
doing it,
okay.
like I'll randomly just be talking to them, I'm like, yeah,
Just like you're doing.
so, what did you have for lunch yesterday? No. But like, and another thing, like, I mean, I just finished my RN program, so I bought this, for school, but I use this because it's, again, we've had like picky surveyors that'll be like, oh, you touched your notebook is in here. Well, yeah, where am I gonna put my notebook? I'm not gonna put it in my pocket, But again, like this bag I like because it has a clean area, so I can leave my, But again, I like this because I could just wipe it, and then
Put it back.
you can, anything, any clipboard or a notebook, or I also use this for just taking my vitals. Sometimes they'll ask you, so how do you record your notes? Like, I don't know what program do you guys use?
There's Kinzer.
Kinzer. Okay, so they might ask you, so where do you take a laptop in to your?
No.
Okay, so how do you take your notes?
I have
When-
a notebook.
When do you submit the, like just simple stuff like that. So just make sure you have something to say. Like, okay, I document everything on here, and then I go in my car and I chart. They can't say, whatever. But make sure things that you have, like you're not going in and out of your bag. I'm just taking stuff out as I'm like speaking. But so when we're using, and remember, no stethoscopes around the neck. That's like a new big Joint Commission thing. Yeah. And we're all used to, doing this, or I'll take the blood pressure and I'm like, no, no stethoscope around your neck.
I got a question.
Yes.
Now, because I have a folder that I use for patients to sign the timesheet. Now, do you have a specific spot where you would put the folder, and then would you sanitize the folder right after, and then let it dry another 10 minutes, and then?
No.
It all depends on where you put it. So if you have an outside compartment in your bag, you could put it in there.
Okay.
But if you're gonna make sure you know what's clean area, if you take that out and you put it back into the clean area, that means you contaminated
So
your bag.
once the patient touches it, I should sanitize the.
Yeah, you can. You don't have to. It's not, because sometimes, it's also a cultural thing. Like patients will think like, and then you want to explain also to the patients that we do this just to protect you guys, and then to protect everybody, from cross-contaminating anything.
Excuse me,
But, yes.
but can we take the whole, like I have the sign-in sheet in my notebook. Can I take it out and put it with they have a folder that is our folder that we
It's like
write
a
everything
division
down.
packet.
Can I take them
You
out
know,
and put
till
them
this-
together and then finish everything and just kind of put it away?
I kind of put it on my barrier. Like right now, I'm just kind of because like usually if I can set it out a little
Okay.
longer, I do. But like because I don't have a wider space. Sometimes they have bigger. Sometimes you don't have this space. Sometimes we'll go on like the patient's in the bed and you have to set it up on the bed, and that's okay. You can set it up as long as wherever you're putting it is like you have a barrier to put on. Because they don't like us taking, because they don't know before this patient where
Right.
was that folder.
Okay.
So you want to put it on something that you've brought with you.
Okay.
So when you have this there, like I'll put this here, but I'll have a longer one because that's the next thing I'm gonna get to. You do your blood pressure. Well, when I take it out, first patient, if I'm gonna go with the surveyor, I'm not gonna wipe this because it's already clean from the previous, I've already cleaned it. But the next patient that I'm gonna go, like once I take the blood pressure. Now there's a 2-minute, usually 1 to 2 minute dry time for the alcohol, and they're very cognizant on that. Like they want to see that we know that we're not just wiping and putting it back in there, because then that can acquire more germs. So you wipe your stuff, and then like let's say if I'm gonna wipe this, I'm gonna put it on the side. Like I'll be talking to the patient. So what did you eat last night? How's your pain? Like blah 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 whatever, and I'm gonna set it up on this side. Like whatever I take out to use on my patient, it's here, and then as I'm using it, I put it on this side here to dry, because they'll ask you, sometimes, oh, okay, so how do you know that like that's clean? How long do you leave it out? 2 minutes. We leave it out for 2 minutes for it to dry. So that's how long it takes for the alcohol to dry off of this, for it to be sanitized enough to use it for the next patient. And then we put it back into our case. Now every time, it's just something I'm used to. I wipe my stethoscope, like the whole thing. I'll wipe with a new, and you want to use a new wipe if you're going to be wiping your stethoscope. But I like to use the little alcohol wipes to just wipe this part and the belt to just, I'm going to be assessing. And whatever you're going to dispose here. Now, if you have a wound care patient, it's completely different, because you can't use the paper towels. You need to have a plastic barrier, something that's not going to leak through. And I understand they're going to get chucks.
Yeah.
The bigger one.
The big blue
The
chucks.
one that's
That's like
water.
your,
Because if you're using saline or whatever, and then
if it spills, or if you're, and then you have to double bag all that stuff. You can't. You have to have the biohazard bags, and then you can dispose of it if it's double bagged.
Just biohazard bag. Okay.
And do you recommend like cleaning up the equipment after the treatment or right
No,
after you do
that's
that?
what I'm saying. As you're doing it, wipe it and set it aside. Like once you check the blood pressure, once you check the temperature. Now I like to, everybody uses their own. So I like to use this one, because it's just easier and the patients don't have to wait, and it's easier to just wipe the whole thing. But you always have to have a backup, because I've been asked, oh, what if your batteries run out? I have Tempa dots. We're good. I have a oral thermometer. Like
What is that one? The
Tempa dots? Yeah.
what if your batteries die?
Yeah, what if your battery dies? What if,
That's good.
I mean, I
because,
do carry
the-
battery, like
we're not
sometimes
prepared
I'll
for
be
that,
like,
so now
It happens sometimes.
but it's stuff that they ask. I have oral thermometer. Like, what if this doesn't happen? What if that,
Okay.
there's always, have your bag, like, nurses are all hoarders, we all are. We like to carry stuff with us, So I like to have everything in here. Sometimes they'll ask you for like I have these biohazard bags. So they'll ask sometimes if, like, let's say like this runs out, I have like emergency, like just in case. So they'll be like, oh, but that's not your, well, yeah, at least it's better than nothing. You want to sanitize with something. So always have enough, like, probe covers, like have things to cover yourself. So if they ask you questions out of the ordinary, you have an answer for them. don't seem nervous. Medication reconciliation is another thing. Like as soon as they walk in, before like many months ago, they used to wait and then they had to do it and we would sit with them and then they would. But
Yeah.
now they expect us to
Do it.
do it. So take initiative. Go like when you go to your patient's house, like make sure you check the meds every time because every time they will place it somewhere else. It happens. So when you do check your meds with them, just go through, like read off of whatever you have, highlight or put a little check mark so that they know if they check it that you've been doing that.
I just want to add something.
Yes.
For the PTA, make sure you check your patient. If you're the only one that's seeing the patient, there's no nursing. So if there's no nursing, you guys have to do the medication reconciliation. You don't have to know all the medication, but at least you need to show that you're checking the medication.
The most important thing is to catch if they have something new. If, you know, they might have gone to a specialist and they gave something new.
If
And-
it's a PT case, but
If it's
you know.
Yeah.
So it might help us if we, get maybe like a note from whoever assigns the patients to us that we're the only ones that
I would want you to check the system. When you're doing your notes, you will see if you're the only one in. So go to the nursing. If there's no nursing, then you
Or the
guys
pro
don't
team, it's just gonna say there who are you with.
Okay.
Yeah, and sometimes it's surveyor based, depends on surveyor. Sometimes they will check, like when the PT is there or PTA is there, they will check the meds themselves and just come out. Sometimes they won't, but it's a good habit for you to ask if they do have any new meds. Okay, just tell them, remind them in front of the surveyor, if you get any new medication, call the agency, let us know so we can
Okay.
let your nurse know and blah, 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 and update everything. They just like to know that there's communication within the staff. That's it.
Even if there is nursing, not nursing, it's
Yeah.
always a good question to ask from the PTAs if you got or did you get any new medications since the last time I saw you, and if they did, you just you don't have to know the meds, the side effects, teach them. You just translate that information to the office, and that way we know that if something were to come up, they're not double dosing. You see a lot of crazy things where one of my other agencies I'm helping with, a lady overdosed on pain medicine, and she didn't tell her family, she didn't tell anybody. She was taking like 3 times the dose of Norco that we're supposed to be taking. So, and if you constantly ask it, it helps with the situation. So.
Yeah, so, and also another thing, like as far as like bag technique goes, you don't wanna, again, like just don't go in and out of your bag. If you have to, like I forget things, if you forget something or you remember you wanna do something else for the patient, always just sanitize, like just sanitize. That's gonna be your best friend in the patient's home, like just keep using it, they're not gonna ding you. Now for me, like I get grossed out with feet, so if I'm gonna check like for edema, I'm gonna wear gloves. And then, but sanitize, gloves, off, sanitize again. Like keep sanitizing. That's another.
Now, the placement of the sanitizer bottle, is there a specific place you should put it since you're putting your hand back to the area where it's dirty?
Well, if you're not touching anything
It's not
else,
sterile, so it doesn't matter.
Okay,
I
okay.
just keep it on my
Just as
right
long as there's
here.
a pad.
Like this, the way I set up is
Okay.
the way I set up at the patient's
Clean
home all the
technique.
time. Like
to clean,
You know,
you gotta have your
it's-
clean area and your
Yeah,
dirty
dirty
area.
area.
Yeah.
Once something you touch
yeah,
is
and that's
dirty, then
that's
Yeah,
the
I'm
thing.
just a
Like
little worried
I'll
it might
move
ding
it
you for
from
something
this
else,
side
something
to
like
the
that.
other.
Position.
Just so it helps me remember, I took the blood pressure, I took the temperature,
Okay.
And then always ask your patient, sometimes they don't want it, you don't have to, it's not mandatory. Like it is, but like, if they refuse, we don't have to force them, we just say patient refused. And that's another thing, like people are always so like, picky about always filling everything. Sometimes patients refuse things. And then we, just put a little R in your notes, that's it, they refused.
But-
And yes.
Sorry, but we can separate them like clean on the table, clean, dirty.
oh yeah.
Yeah.
I think
And the most important, like, get into the habit of when you're there with your bag,
Mhm.
just take everything out you need from
Yeah.
your bag at once and
That's
zip it closed.
That's what I'm saying, like I'll usually
But if
have
you
like
can,
a
if
lighter.
you need to go back in, you gotta make sure
It's just sanitized.
you sanitize. then you go back in and then sanitize
But
again.
if you don't have a, let's say you have a little space, little than this, you can still work on that, right?
Yeah, because I've had like hospice surveys where I've had just a little like the side of the like the end table, but and then there's always a little space, so I'll take like the clean area or whatever. I'll put like my bag one place, but I'll put like paper towels or the chucks like on the bottom of the bed, like on the foot of the bed, and
Okay,
I'll
so-
just so you
Yeah.
they just want to see how we utilize our space, and because sometimes we're not given the luxury of like
Correct.
a nice big table where we can spread everything out, and you don't want to be like, oh here look, this is my clean and this is my dirty, and look somebody just we got trained to do this and we're gonna use this because we
Then you
always
can have another.
try, but our best to do the infection control, but sometimes they'll pick at us for the weirdest things, and just make sure that you have something to cover yourself. Just again, their number one big thing is, like Brett said, to have the equipment that's clean stay out till it's dry. Now the stethoscope, even the stethoscope, it's plastic, it doesn't take as long to dry, but still, that's just the rule of thumb, 2 minutes. So just leave it out, use it, sanitize it, put it aside. If your patient asks you again, oh, can you check my lungs again? Like sometimes they'll, oh, okay, oh, can you check my blood pressure again? You do it, just remember to keep it out again, because you need to sanitize it again if you use it again, even if it's for the same patient. So, that's pretty much it. I think anything?
Always, and then when you're walking out of the house, zip your bag closed
Yes.
again.
I've got dinged on that. So if I'm putting, sometimes I had like too many things, but try to like stuff it in there and just zip it, because like they want to make sure that you walk in zipped and you walk out zipped.
One
So-
thing I've seen them do is they might ask you to open up your trunk.
Mhm.
And so if you're gonna go on a survey, make sure your trunk is clean. Because for example, if you're bringing something, you did wound care and you have the biohazard bag, you need to have a dirty area in your trunk to put something there, and then you bring it to the agency, drop it off. Another important thing for the surveys, folders, right? You don't wanna leave anything out on the front seat that has HIPAA. So just everything you basically have if they ever ask you, we have a clean and dirty location in the trunk. And before they even walk in, they might say, pop your trunk and let me take a look at it.
Yeah.
And if you have all your gym gear in there and stuff, like.
Yeah,
doesn't,
just 2 chucks. Like what I have a Ford Explorer, so like in my trunk I'll put like a blue, like the big blue chucks. I'll put one this way and one the other way sometimes. And then so if they ask, sometimes they'll ask. So just have the chucks there and be like, oh, I just keep it there. And if something happens, I can just bunch it up and throw it out when I'm out. But good thing here, another thing, I know I love to use, but like, do not use during a survey. I don't know if for Joint Commission, these are conditions.
So don't use it.
Even if you're using it for heart rate,
Even unless there's an
unless
order,
you have an order
it's
for
on the plan of care.
SpO2 sat, it's a condition, automatic condition.
So just check it manually.
Some people, like to use it just for the heart. Oh, I
Yeah.
use it for the heart rate. No, did you have an order to put it? Like it's the
Okay.
smallest little thing, but this is the biggest
Thing.
condition.
It's like you're doing something without a doctor's order.
Hospice, not so much. Yeah.
Yeah.
Yeah, it's considered a treatment.
don't use
so
Just don't use it.
Don't use
What
it.
about
Just
the-
don't use it.
With the machine, you know how it gives the pulse?
And
Like,
another,
that's okay?
they
It's not
like to
accurate?
see manual.
Okay.
You can use it if the patient has it. There's some, like I specifically had a patient that has his own, he likes to use it.
Mhm.
And I tell the surveyor, they want to use their own machine, that's fine. I wipe it, leave it, and then use it on him, and it's there. And another thing, of course, we have the stopwatches on our phones. Don't take your phone in and out of your pockets. Leave your phone, like if somebody's calling you, don't answer it. Again, like,
Excuse me.
yeah, it's a simple thing. I mean, I know you probably won't, but sometimes it happens. You see, and it's like your
Probably put it on
wife
silent.
or your husband or your son or your daughter.
Yeah,
Yeah,
I
don't
read
answer.
an article where it says cell phones they have more germs than a public bathroom
Yes.
does. So it's
So like
and you,
you
see
don't
kids
wanna
like chewing on it.
you don't wanna like put it on the table or just leave it in your pocket. I mean, I always just leave it in my pocket.
So what I've been doing, I've been practicing too. Like I put my pen, my phone, and I sanitize them all
Yes,
too at the
you
end.
can do that
Yeah,
too.
that's-
It's
with
sometimes
the alcohol.
if I give the pen, yeah, or if I'm using the pen, I give
Sometimes
it
I
to
use
them.
the timer, so you know. Like,
Yeah, you can. It's if you want to, if you don't have a watch and you have to use, like for the nurses mainly, like if you have to use your phone for the timer or
To
whatnot.
let them see them sanitize.
Yeah,
Yeah.
at least sanitize it, put it out, use it, and then make sure nothing else like pops open or like because they're very very picky on that. Like it's
Just put it on silent.
yeah, it's a
Or
huge
put it away.
thing for them.
Again, just to go off of what you there, there is no one way to do it.
Yeah, there's many.
It's the good thing is just to keep in mind to make a habit of the clean. Like if you're gonna do something, you touch, you think you got dirty, just sanitize and clean your hands. It's just you can't do it enough. And the crazy thing is, you might do it so much they might say, if you do enough of that, your hands are gonna get dry. She's been told that.
Yeah.
But it's better than them, writing a deficiency for that. So it's like, it's the principle of it, just knowing that when you walk in, you have to clean your hand, you have a clean area, dirty area, keep your bag zipped. Whatever you use, you have to wipe it down, let it dry.
And then we do it. It's for the agency. It's just because sometimes like we'll have surveys where I've done all 3 visits. There's been surveys that I've done just 1 visit, 2 visits. But like, let's say if they're gonna be following you, like let's say glasses. Glasses are a big thing. Like we do it like unintentionally. Like I was telling you, I put up my glasses, and she's like, "Oh, you just touched your glasses," and I'm like, "Yeah, I mean they were falling off my face. And I'm not gonna let them
these are
fall."
farmers.
And she's like,
Yeah.
"Oh yeah, like your
Yes.
hand, use it like this." And I was
Yeah.
like, "Oh okay." Like I didn't even think of it like that I was doing anything wrong, but they're watching us. Like, so sometimes if you're doing more than 1 visit, they'll give you the chance to like kind of fix your problem at your next visit. But sometimes if you're not, they don't have that chance to know. Okay, this nurse, I've been in LVN for 15 years now, so it's like, okay, if I haven't done it for 15 years, guess what? I'm gonna do it at that 1 visit that I wasn't supposed to do with the nastiest surveyor that I got.
Do you guys give them CPR masks?
Yeah, that's another thing. They
That's
ask.
Okay.
CPR mask is
You can get them from the Red Cross too. If you have one nearby.
good to keep by even.
Yeah,
And then
they'll ask.
everybody-
Just to reiterate something, the 2 minutes is what they're using. So you might be working at another agency that's using a different cleaning, then that might be 3 minutes,
Yeah.
1 minute. So,
But
The
can you
face
get it
shield.
at Amazon?
yeah.
You can, yeah, you
So
can.
we're gonna.
And actually, I don't know. I think they expire, but like they haven't really. Yeah, they do expire, but this one's like ghetto old, like really old. But it'll probably like shatter if I take it out. But at least they know I have it. If anything happens, I have one.
I got a few questions.
Yeah,
if you
yeah.
guys don't mind. You guys
Sure.
mentioned about a dirty bag that you have to have one in the car. They might ask you questions like, "Oh, where do you dispose this?" Is that
No,
what you said?
not a bag.
Not a
a
bag, but
dirty
a dirty,
area.
Can it be like an area? You don't have to have like a container.
No, it
Okay.
can be like a bag that
A
you put
plastic
everything
bag.
in
Yeah,
there.
that's what I mean.
Yeah,
And then are they gonna ask you questions like,
Of
where do you
course.
dispose this
Yes,
stuff at?
and-
Say it's gonna be here
Yes.
at this look.
So
at your,
let's say
it all depends. Some
Cause-
agencies have like drop-off locations. Some
Mhm.
agencies you bring it to, and I believe you guys have do you have a bio?
Yeah,
Yeah,
audience.
I saw
they
it.
have
Then you
There.
bring it to the office.
But
Like the
as
sharps container
The
that's
sharp.
full.
Mhm.
You want to double bag it?
But as therapists, we don't really have stuff like that.
Yeah, not
No.
but for the
It's usually
nurses.
for wound
Like if
care
they
and stuff.
ask
They
you,
would care.
sometimes they'll ask you if you have DID, if you have
Insulin.
insulin dependent patients or just diabetic patients. Also, if like the sharps container is full, where would you dispose of it?
In the office.
Okay, so but you have to double bag that, and then bring it, and then it's here. And then another thing with the nurses mainly, it's a kind of like their favorite trick question. So if your patient if you have a diabetic patient and their glucometer is not working, do you carry one with you?
She
Do
said,
you?
yeah.
But do you?
No,
No,
No.
the answer is no.
no,
Never.
We don't have.
We
one.
don't. So what if you're gonna do that visit? I'm just gonna ask you. I'm not picking on any of you. I'm just asking you just to. So if she asks you like, okay, so you go into the patient, you're here, and the glucometer doesn't work. I've been asked these. That's why I'm just asking. Just FYI. So what would you do? If the glucometer is not working, but you have the order on your plan of care, how would you check? What would you do? The glucometer is not working. You're here on your visit, but your glucometer doesn't work.
The patient's glucometer is not working.
It's not working.
Then
I'm not gonna take it.
I'm not gonna take it.
But what are you gonna do?
I'm just gonna try to like ask the patient if they can change the battery. Maybe the battery is like it needs to be changed, or if it doesn't really work, if it's broken, then I'm gonna call the doctor to ask for another order.
Perfect.
That's the
They just
easiest thing.
wanna- yeah.
If you're in
Doctor,
doubt, I'm
always a
gonna call
doctor.
and
If you're
report.
in doubt, call the office. I'm gonna ask my DON. I'm gonna, I'll call the office first because why? Because sometimes you're on the phone forever to call the doctor, right? I'll call my office and I'll report it to my
You
DON
call the
or my nursing
supervisor.
supervisor, and we'll take care of it. I'll ask for another visit. I'll come back and I'll check the patient.
And if the patient has already checked their blood sugar, there's
You don't have to.
don't
Yeah, you don't have to.
just go jot down
You
what
can
they
ask
say.
them.
The
Like,
less
let's
you
say
do,
it's
the
close.
the
The
more
more problem.
yeah,
Less
not
is
less
more.
problem. Yeah, if they checked it,
And then
Why-
calibrating the machines. Most now don't need calibration, but again, it's another thing that they might ask
a
you.
lot of these, you can always a lot of the equipment. If they ask you how do you do this, you always say per manufacturer guidelines. So it's just like throw it back on.
Yeah, that's your go-to answer. The manufacturer guidelines or per the agency's,
Yeah, that's the best thing. It's like every manufacturer has a different way of doing things, and so when they meet you the first time, they're always gonna ask you, "Is this the first time you're seeing this patient?"
Mm.
Yeah.
And if you say yeah,
You better explain yourself.
yeah, no,
Maybe.
that's fine. When you walk in there, you gotta
Yeah.
do a better job of introducing and the two patient identifier,
Mm.
and the address is the identifier. So the patient's address can be an identifier. So if it's not the first time, you don't, they're not, you still want to, you identify them because you've been there, you talk to them, you say their first name. But if it's the first time, you gotta, just like the hospital, before you give a medication, you ask a birthday, you have to do that.
and always introduce yourself. Even if it's your third, fourth, fifth visit, just be like, "Hi, Mr. Jones, remember me, Frida? I'm your nurse." Yes.
And if you have a patient who doesn't speak English well, and you're comfortable speaking with them in Tagalog, Spanish, French, whatever it is, feel free. The surveyor might ask you to
Translate it.
translate. Don't
Better.
feel like
Those are
you
the
have
best
to
visits.
speak to them in English. That's the way. And she might ask you, "What did you say?" Just translate back. That's all. So do your visit like they're not there, and speaking the language that the patient is comfortable with.
But if the patient is
Non-verbal at all?
non-verbal, yeah.
Do they have caregiver?
Caregiver.
Yes. So we talk to the caregiver.
Caregiver. Most of
I
the
mean,
time.
sometimes you'll have those caregivers that'll just be like saying random stuff and you don't
Yeah.
want them there.
Yeah.
Just be like, "Oh, can you, I'll
Need
get
to
you."
be